There's a migrant shelter for unaccompanied children located near El Paso, Texas, and Fort Bliss. And this overcrowded facility is housed between 1,000 and 5,000 children at a time. Now, thanks to two whistleblowers, we're learning about terrible conditions inside this shelter, including huge coronavirus outbreaks among children and a lack of adequate masks.
And there were these tents all over these places, these massive tents, just crowded with kids. This was an environment in which COVID spread very, very rapidly amongst the kids and ultimately amongst many of the staff as well.
We were told to not share practically everything we witnessed there. We were told to not be on social media, to limit our conversations about the site with close friends and family, and to definitely not talk to the media.
The two people you heard there are the whistleblowers, both career civil servants who volunteered to be detailed to the shelter when the Biden administration ramped up staffing to accommodate an increase in unaccompanied minors. They filed a complaint with the nonprofit Government Accountability Project, writing, quote, at a town hall meeting with detailees, a senior U.S. public health service manager was asked and refused to say how many were infected with COVID, because if that graph of infections is going to the Washington Post every day, it's the only thing that we'll be dealing with, and politics will take over, perception will take over, and we're about reality, not perception. All the manager would acknowledge is that several children had to be hospitalized. Julie Ainsley, NBC News correspondent covering the Department of Justice Homeland Security, has been covering this story, sat down with the whistleblowers. And NBC News has also obtained exclusive audio from inside that facility in Fort Bliss. Julie, I want to play that in a moment. But first, just to set sort of the context here, we're talking about this is the Biden administration that had a huge influx of unaccompanied minors that were spending way too long in CBP custody. And there was a concerted effort, because CBP custody is no place for kids of any kind, to move them through that system to custody of HHS. And in response to that, HHS scaled up its shelters, and this is one of them, right?
That's right. I mean, at the time, if you think back to March, when President Biden would announce that another shelter was opening, he was trying to give the biggest numbers possible. He talked about Fort Bliss opening for 5,000 children and potentially being able to hold 10,000 children. That was a win for them because they were able to get children out of the terrible conditions in Border Patrol custody where they were never supposed to be for over 72 hours. I mean, they had a bed, a place to sleep. But instead, what it meant is because of these facilities having to be emergency intake facilities, they had to rely very heavily on contractors. They don't allow state licensing. They don't have state licensing when they do these emergency intake facilities. So there's a lot less oversight, a lot less transparency, and that allows this kind of environment to fester, especially when you talk about those big numbers. And the whistleblowers we talked about beds being so close together that you couldn't even go through them. As you've seen from pictures we have, these are cots stacked on top of each other. They're not real bunk beds. It's the kind of environment that would make COVID spread very quickly. And it's also the kind of environment that when a child has a real medical or mental health concern, as many of them did, they don't get that help as quickly as they should.
Yeah, I mean, it sounds like from the whistleblowers, this is just an overwhelmed facility. This is not functioning in a way that can be child-centered in any way. I want to read what HHS Secretary Javier Becerra said. He said, our duty at HHS is to provide safe, appropriate care for the unaccompanied. We take allegations of wrongdoing seriously and swiftly report allegations, not only the office and the inspector. We constantly work to improve the conditions and services required to care for children in these challenging settings. I've been to Fort Bliss, including this month. I have inspected conditions of facility and questioned site managers. I've spoken to children while they're in our custody would continue to receive safe, appropriate care, and every emergency site will be investigated. My question, I guess, for you is what now happens with these complaints, and are there going to be changes at this facility?
Yeah, I mean, that's the thing they're not committing to, right? They're talking about taking piecemeal allegations and referring them to authorities, referring them to their internal controls through the Office of the Inspector General. But what we haven't heard either from Becerra or from the White House is to do a wholesale investigation of Fort Bliss and of other emergency intake facilities, and to get to the bottom of why these contractors got this contract in the first place. The three contractors involved here who were running the facility when our whistleblowers were there, which I should point out was April through late June, they had no previous child care experience. None of their contracts ever involved taking care of children. They dealt with military intelligence and disaster cleanup. And between the three of them, they had $1 billion in contracts. So those are the kind of things we're taking on as investigative reporters. And it seems that there would be a time for the administration to also be looking at that wholesale approach too, rather than taking piecemeal allegations. And as you know, some of these allegations are very serious. It's not something you would want an inspector general to handle. You would want someone to come in right away and see if someone needs to be immediately removed from caring for those children.